Good afternoon, everyone, and welcome. Thank you for joining us. My name is Karen Bell, and I'm the Associate Director for Partners for Advancing Health Equity, or P4HE for short. We are a national research learning collaborative that brings together various sectors to harmonize efforts towards health equity and promote actionable solutions. These sectors include government, academia, civil society, philanthropy, and the private sector. We are based at the Tulane School of Public Health and Tropical Medicine, and we are supported by the Robert Wood Johnson Foundation. One of the ways that we bring together these various sectors is by providing interactive spaces for activities like today's webinar on funding change, a conversation on philanthropy's visions for health equity. Funders and philanthropic organizations of various sizes and backgrounds can support the advancement of health equity in a variety of ways. Community organizations, researchers, healthcare organizations, and advocates rely on philanthropies to set an example and provide funding to further the work in health equity spaces. Philanthropies and funders often focus on service delivery historically, but shifting funding priorities to different types of efforts can be critical to advancing health equity goals. So we'd like to start by asking you a question that will help us to focus our discussion on today's webinar. For that, we will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to menti.com on your browser or mobile device and entering the code 1-889-9550. So I'm going to do that as well. So if you want to join us, go ahead and feel free, but I think we can go to the first question. What role do you think philanthropy plays in the advancement of health equity? What role do you think philanthropy plays in the advancement of health equity? I'm going to answer that question as well. You can take some time to think about it, and let's see your responses. Okay, funding grassroots groups, creating a space for innovative approaches. I like that. Shapeshifter. Oh, that's interesting. I really like that response. Too big of a role given that small numbers of people control dollars. Yeah, that's definitely something that we will get into today. Funding community, leading a convener, building collaborations. Thank you for scrolling down the screen so that we can see all these responses. Funding projects driven by the people impacted by inequitable health systems. Really, that's important, definitely. Sustainability, funding for activities that can't be accomplished with other funding. Yeah, that's definitely critical. Someone said that philanthropies can foster neocolonialism. Yeah, we're going to talk about the history of philanthropies and how they have functioned and figure out ways to get away from that. Its role can be to convene and create co-creative spaces for partners to fund innovative ideas to advance health equity with the community at the table. Okay, so we're seeing this idea of bringing multiple sectors together, as well as centering community. Definitely, thank you. A huge role. The U.S. is driven by capitalism, yes. An effective way to reduce inequities is through funding of organizations that are working to do something. Yes, that is critical, that we have to understand that we are operating in a capitalist society, funding the community and convening funded health and social determinants of health providers to integrate service. So again, convening across sectors, very important. It's clear that we have been thinking about how philanthropy plays a role in the advancement of health equity. So this is not only refreshing and reassuring, but it makes me think that we're going to have a important, fruitful, and hopefully advancing conversation here. I think we can go to the next question. Okay, this says rate your knowledge on the history, which is something that has already come up. Rate your knowledge on the history of philanthropies in the health space. I'm going to do the same thing to make sure that I am participating. All right, I hit submit. I said some knowledge just so we're, being open and transparent. We see that most people have said that they have a limited knowledge. Some people say they have some knowledge, and some people say they have a fair amount. Okay, so nobody says they have no knowledge. That's promising, but even if you don't, that's totally fine. That's why we're here. And then nobody said they have an expert level of knowledge, which also, if you do feel like you have that, that's totally fine as well. We are not only just here to learn, but we're here to collaborate and speak to advance things together. So I think that, again, if you want to continue to respond, please feel free to do so. You can also continue to share your thoughts and comments and questions in the chat throughout today's discussion. Additionally, you can join this conversation with your questions and comments beyond this webinar on Twitter and other social media platforms by using the hashtag partners4HE. I think that's critical because we're hoping to start the conversation here, but as you have seen with some of our other efforts, we very much focus on extending the conversation beyond just these webinars, and you're a major part of that. So with that, I'd like to welcome our guest speakers. First, we have Dr. Halima Leake-Francis, who is the director of the John Lewis Public Administration Program and professor of practice at the Tulane School of Professional Advancement. Welcome, Dr. Francis. Hi.
Thank you for having me.
Yes, of course. Thank you for being with us. Next, we have Dr. Laura Gerald, who is the president of the Kate B. Reynolds Charitable Trust, and that's in my home state of North Carolina, even though I said I wasn't going to point that out too much, but I said it, and now that's it. I won't mention it again, but welcome, Dr. Gerald.
Thank you. It's good to be here.
Yeah, thank you. And next we have Natasha Phelps, JD, who is the director of equity-centered policies for the Center for Black Health and Equity. Welcome, Natasha.
Thank you. Thank you for having me. Happy to be here.
Yeah, thank you. Thank you all. I think I want to start us off by giving or asking each of you to tell us a bit about your work, not just because you're coming from very different perspectives and experiences, but we all need to learn about maybe shifting or expanding our framing of how philanthropy and funding works. So if you could tell us about your work and share, in your opinion, how does philanthropy impact these systemic issues that underlie health inequities? And whoever wants to start, I did not plan who should go first. So whoever wants to start with that question, please go ahead.
So my name is Natasha Phelps. Like Dr. Bell said, I am the director of equity center policies at an organization called the Center for Black Health and Equity. And the center is a nonprofit organization, a national nonprofit organization based in North Carolina. North Carolina, very prominent on this stage. And we started out as the National African American Tobacco Prevention Network, where we really supported community capacity building and infrastructure expansion so that they can work to promote policies that advance Black health. So in the beginning, our bread and butter was really about, commercial tobacco control, outreach and cessation support for African Americans, et cetera. And then our portfolio expanded to address a variety of different health outcomes, and even more recently, address some of the systemic drivers of the things behind the health outcomes that we work on. So going from tobacco to then doing, HIV/AIDS work, doing work on fibroids. So just kind of expanding in that way. Now, the department that I am running is the real economic, environmental, and social changes that happen because of policy, the collateral damage of that. That's what we are exploring now through our Equity Center policy work. So that's actually how we came to this stage today, was because we have been doing many different things about making policy more accessible so that people can understand the systemic root of some of the problems that is expressed in community work that's already happening, because there is so much that needs to be said. There's so much good work being done. We just want to support organizations do it in a way that feels like they can do it the way that they know it needs to be done, because we believe communities are the experts, obviously, in their own community, not only just in what we focus on, but also how we do it and how we go about doing that. So we work with communities all across the country to get them, built up to work on these types of policies. And we get funding from many different sources. So we have funding from private foundations, from federal, state government. We've gotten, sponsorship for our annual conferences. So we work a lot with our funders. I also have come from nonprofit organization work that was more of a legal center kind of way. So that's kind of the experience that I'm coming with, is being with the community and hearing what they need, and knowing that we want to give them the best support that they need, that needs to be done a different way for it to be effective. And then us communicating that to the funders, because once they fund us, we fund the community, and we build their capacity even through their association with us, because we are a support system for them. So that's kind of what I have to bring to the table, is kind of communicating how it is that we as a Black-led national organization function and engage with funding and the requirements that come with that, and then our connection to the community, and what we know is that their voice needs to be heard. So that was a long-winded way of explaining, but that's my connection to philanthropy.
Well, since North Carolina has been mentioned twice now, I'm happy to go next and give you a much different picture of how philanthropy is addressing health equity at the statewide level. So the Kate B. Reynolds Charitable Trust is located in Winston-Salem, North Carolina, which is in Forsyth County. And our mission is to improve the health and quality of life for people who are experiencing poverty in Forsyth County, where we're located, and across the state. So we have a place-based and a statewide presence. We have been around for just over 75 years. We celebrated our 75th year last year, and we've been at this for a while. So we have instituted almost every model that you could think of in terms of how philanthropy can address health equity. But over the years, we've had to reinterpret our vision. And currently, we envision a North Carolina where all residents and communities are thriving, and there's equitable access to care and health systems leading to more equitable health outcomes. And what we have determined in looking at, again, how are we going to get to our mission, doing what we do, we have to go through racial equity. And so one of the things that we've been able to do is create a real framework and case for addressing health equity, and specifically racial equity, in order to get to health improvement, because of the outcomes that we're seeing, which are so disparate by race and place. So we do a lot of work in communities that are in rural parts of the state, because they experience some of the worst health outcomes. And we also, thanks for the anniversary shout out there in the chat, we also do a fair amount of work with grassroots organizations, many that are in Black and Brown communities that are trying to, frankly, build up the power that has been lost at community levels, institutional levels, statewide levels, particularly in political power, economic power, and educational power. And so what we do is work across all of those levels. We work on institutional racism and systemic racism, and we also work at the local community level and at the statewide level to impact change. And all of that is directed towards systems change, which is a little bit different for philanthropies. Like I said, we've been around for 75 years now. We've done charitable funding. We have done programmatic funding aimed at fixing the broken people who have the health problems. And we have finally determined that, you know what, the people were never broken. They were disenfranchised at the population level and then asked to get out of it one person at a time. Hence all of the programs that were aimed at helping individuals navigate around the potholes that were put in the road in order to impede their progress. And instead of doing that, we have said, okay, we're going to actually work on the problems at the level at which they were created. And we're going to do a multiracial, multi-sector, systems approach to change, again, at the level at which people were disenfranchised. And so that's what we're doing as a trust. I hope to talk more about that as the afternoon continues.
Yes, thank you so much. And as I think about what you both have shared and Karen, the questions that you posed earlier, I look forward to this conversation because I think that our different perspectives and work will give a really robust picture of how philanthropy can advance health equity in a truly authentic and hopefully sustainable, long-lasting way for our communities. So as shared earlier, I'm Halima Leek-Francis. I'm the director and a professor of practice in the John Lewis Public Administration program here at Tulane in the School of Professional Advancement. My work here really focuses on preparing professionals to continue, honestly, the legacy of the work that that's been shared here. So we focus on educating students to be public service professionals and administrators. We offer a Master of Public Administration degree with various concentrations and also certificates in areas, including things like economic development, environmental management, nonprofit and philanthropy management, in various areas that we've identified are tied and critical to being able to effectively lead in public service contexts. One of the things that we focus on is, as I think about how we shaped our curriculum, we launched our program in fall of 2020. We named our program for Congressman John Lewis last October. So we're also recently kind of celebrating an anniversary there. But in shaping our curriculum and thinking about the principles that guide our work, we focus on what does it look like for professionals doing this work, whether they be in nonprofits and philanthropy or government, working in policy, or even in the private sector. What does it look like for professionals to approach their work, understanding dimensions of equity, and how do you navigate community priorities and proximity? Also, preparing them to do this work in an ever-changing environment. So there are constantly challenges, as we know, kind of navigating the heels of COVID and the lasting, enduring effects that are there. I think this compels us to think about innovation and in a true way, not in a buzzword sort of way for the sake of doing new things, but innovation with a sense of what are the real impacts and what are the real consequences and opportunities as we are pushing forward the changes that we realize were needed as a result of what we experience in our communities, right? So we're really focusing on preparing professionals to navigate that. Also, another element of our program really centers things like data and technology. We've seen that having this experience, this most recent experience with COVID and other issues, that technology is going to be, or is something that we do have to navigate and figure out how to use effectively in our work. And data to really test the effectiveness of our work and test the impact. And when we talk about data, what are the appropriate measurement tools? So if you think about data in the space of philanthropy in particular, how are programs evaluated? How is the success of programming and projects and even research, how are they determined? And are they congruent with the needs of the community? And are they congruent with the needs of the organization delivering the services? So that was something, or that is something that as we consider data in particular, how do we communicate, or how do we use data to communicate the work that we're doing? Another element that we focus on is collaboration. And I have to say that my own perspective on collaboration and partnership is evolving. And I'm starting to see it as more of an ecosystem. So a colleague I was talking to recently said that they really don't talk about collaboration. They talk about ecosystems because that in some ways acknowledges the mutual dependence that we have on one another to really be able to do the work. Collaboration, partnership may involve some power dynamics that are not necessarily effective as we look to work together. So looking at it from an ecosystem framework. Much like Dr. Gerald, a lot of our work focuses on system level change, recognizing that things like health equity do not exist in a vacuum, but there are systems and contexts that bring us to the space where we are and needing to make the change that we certainly need to see in long-lasting communities or long-lasting change. We also really sit at the intersection of activism, advocacy, and policy change. So how are we advancing policy that reflects the needs of the communities that we work within? As I think about the needs for professionals working in nonprofits and philanthropy in particular, as it relates to health equity, I think a lot about some of the social determinants that we see throughout our community. So what are the educational experiences of people within our communities that intersect with health outcomes? What do the economic and job opportunities look like in various communities that intersect there, or that can be related to some of the health outcomes that we see persist. Also, what are the environmental, so built and natural environmental conditions and contexts within communities? So we are really focused on equipping professionals to be able to successfully navigate a lot of the complexities that we've talked about here. Coming to this work, I came to Tulane out of practice. So I was a practitioner, and my work and service and research and teaching has always operated at the center of nonprofits and philanthropy more broadly. So being able to be in a position to educate a rising generation of leaders and those who are currently in practice is really, really special to me. And I really look forward to this conversation. And I want to say at the outset, it's so wonderful to be joined by fellow North Carolinians as a North Carolina native, now in New Orleans by virtue of family who's here in New Orleans as well. So I'm really excited about this conversation.
Thank you all. Clearly, we have the right combination of expertise and experiences. So I'm also very excited about this panel. I'm going to ask a question that is not officially on that question list that I sent you all, but it still relates to, or it's a follow-up on something that all of you all said. And we sort of dance around, we acknowledge, but dance around the effects of systemic racism. And you were speaking, Dr. Francis, about COVID in 2020, and I was speaking with students yesterday about how, once the public health world said racism is a public health crisis, then that meant that now we have to do something about it. And I don't know if we always actually articulate what it is that we should be doing and what we can do, but I think that all of you all's work does do something about it. So I'm wondering if each of you could specifically state some of the ways that you all address systemic racism or structural racism. There's, different terms, but how you all specifically address systemic racism in your work or even in your teaching, however it works out. Because I know that you all do, but I think that we don't always specifically frame it so that it's very clear what we should and could be doing. Sorry for that question that was on the list, but I think you all can answer it. So I'm just gonna go for it.
I can jump in there. So as I think about the impacts of systemic racism in the work that I've done, and I can kind of tell a story about this. So in navigating philanthropic relationships, one of the things that I would do is talk about the cost of racism, right? So oftentimes we don't ideologically agree on racism in the moral context. So acknowledging that there's a human impact to racism, and there's a lot of different perspectives on that, right? But it's very hard to argue the impact of the cost. It's expensive when you have communities who don't have access to resources. There are material costs when you have communities who are suffering and are not fairly treated just by virtue of their race. So yes, the moral imperative is certainly there. And I think it's just smart leadership. It's smart leadership to invest in organizations that are doing the work that is proximate and relevant to the communities that they're serving. As we look at the data, before this call, I was thinking about the amount of funding that goes to charitable organizations, and I pulled up the Giving USA report that was recently released, and it talked about giving in 2022. So a little bit over $499 billion went to charity in the United States. And that's a small dip from what we saw in previous years, right? So $499 billion. 64% of that was driven by individuals, but following pretty closely was 21% was driven by foundations. The key areas where funding was given was the top was religion, so 27%, 14% to human services, education was following, and then a little bit behind education, 10% went to health directly. So thinking about the amount of resources that are mobilized in these spaces or mobilized through charitable giving, either on the foundation side or on the individual side, I think about the organizations and who their leadership reflects and who they are, because more often than not, we do see that leaders who are running organizations are usually proximate or close to their communities in identity and experience, in cultural experiences and knowledge. So there's a relationship there. If you extend the question, and a lot of what I've heard over the last few years is that philanthropy has a problem or a challenge in funding Black and brown and diverse led organizations. And given that the leaders of those organizations are typically closer to their communities, what does that mean for the resources that are being driven to the work that's being done? So if you work for an under-resourced organization in a space that is not usually prioritized, or for a community that's not prioritized, you're kind of hit with this double whammy of being under-resourced and underfunded and still being expected to do the work that has such a strong impact on our broader community. So racism does not only affect the disenfranchised, it affects everybody. So getting that message and helping people to understand that, I think, is really, really critically important. So that's some of my early thoughts on it. I know I went around in a circle, but it is a circle, it is a cycle. And we have to acknowledge that there is this cost to racism that we all feel, and that impacts all of us.
Just to add on, we talk about this a lot, in the work that we do, of how, funders might, with their evaluation metrics, with their outcome measures, they might deem a community-based organization or a project or something to be a failure. However, there was actually so much work that was not only necessary to get to the main objective that was desired in the first place, but also it's something that is immeasurable in traditional ways. And so we talk often about how there are these systemic issues that we need to address in the substantive aspect of our work. When we're advancing policies, when we're doing community engagement, when we're doing public education, there are those things that we need to be aware of. And I want to come back to that and what that means for philanthropic work or for other funded work. But for the how we do it is just as important as what we're doing and what we're trying to accomplish. So the idea that we would make sure that if the systemic issues are, in the things that we're working on, reflecting on that in our process as well, because there's, clearly when there is a funder and a recipient, there is a power dynamic that's there, and we want to ensure that the ones who are receiving the funding, being evaluated, being required to do the work, and especially on very traumatizing issues, things that are while they're doing the work, it's impacting their own lives. So there needs, I think, to be some much more grace and much more understanding of that built into the contract terms and built into the understanding of what's expected, because there have been so many communities across the country that have advanced through community buy-in on issues that were not known of whatsoever, or there was some disinformation related to it and there was a negative impact they had to flip. And it's that takes time, and the communities are saying this takes time. This is, even though the number of policies passed here is 0, we also this and that. And so I think the systemic inequities that we see in the substantive work can show up when we are also making it very difficult for those most impacted to engage and do the work, and not recognize the reality for them as well. And then, in the same, so I'm really glad that we're having this conversation right now. And I'm glad this is not a taboo topic, that this is just, I feel that there's a shift happening for a lot of folks who are starting to understand, okay, come on, we got to get to the root of this thing. Because how many times do you hear, you try to pass some policy, a community does a lot of work, they got a great coalition going, they get a policy on the table, and then the champion does some backdoor deal, and then they have some exception. When is the next time they're going to come back, put tobacco on the agenda, put some park policy on the agenda that maybe is just not something that they really want to return to? It's not popular. So it's if we acknowledge that in general, people, especially talking about since the pandemic, People are struggling. People are oversaturated and overwhelmed with the number of issues that are in our face all the time, and then reflected in our lives. What can we do to acknowledge that, and then to invest in impact work that is going to, essentially be a compounded effort of all the things that you've been doing for a long time on these kind of like outcome issues. So the idea that we've had some support in the last couple of years where it might be a funder who is interested in us working on a specific health issue, like I'll use tobacco again as an example. They've actually allowed us to amend our work once we engage with the community, and they said we don't want to keep talking about tobacco product pricing. We don't want to keep talking about, even though it's important and we still want to do it, we want to advance policies that prohibit the sale of flavored tobacco products. We want those things, but it's like, again, like, can we use this opportunity to do something that would like stop this at the closer to the root? And so there is just, people are just tired. And I think that there is a growing understanding that, we got to cut through the noise and really get to the heart of that. So I think that we've done some research as far as what we've done at the center. We've done a lot of community engagement, like I said, hear a lot from them, but then also we've done, recently we did a legal epidemiology assessment on the impact of freeways that were built through Black neighborhoods and the subsequent environmental change that comes with that, and what the related health outcomes are. And instead of because what we wanted to do was understand how were communities considered, what type of community impact assessment was done, et cetera, et cetera. So of course, when we looked back at old laws and policies, none were given. And still, people aren't doing very much right now. As far as like things that consider health equity, things that consider public health, things that consider racial justice. There's a lot of talk, like the Racism as a Public Health declarations and things like that, but there's not like actual functionings or named functions of government that are like all over the place for, the specific issue. But what we did find is that more than ever, there have been these channels created for communities to get in there and just do, if they can just do the one thing. It's like if they can just screw like one nail in or screw in, they could do something to shift the system. So like if you can just take the money that you normally get to work on food and nutrition, but maybe put it towards doing some advocacy work so that the county board, anytime they have an item that goes through their transportation committee or something like that, it has to go through a health equity impact assessment, which necessarily includes racial justice, because you have to if you're doing health equity work. Then like that's an acknowledgement of saving energy and time that people only have a limited amount of, that they otherwise would spend time just on those health outcome, those things to address the health outcome measures, which are just as important. But so that's what we're doing. And that's kind of my reflection on how systemic racism can show up in the work that we do.
Well, my fellow panelists have, framed the work. And since there's so much North Carolina love here on this call, I'm going to talk specifically about what this looks like in North Carolina and the communities that we fund. So in North Carolina, one of the things that we're doing is trying to come up with an accurate diagnosis of what the effects of historical and continued racism are. What are the effects? So when we have our equity framework, or when we put out our equity framework, we released one very recently that's available on our website, www.kbr.org. And in that equity framework, we literally go through the history of North Carolina and how at the turn of the century, when many of the systems that we are currently trying to change, health, education, our political system, were formed. At that time, around the turn of the century, the Native Americans in state had already fairly successfully been removed from the state through the forced migration to the West, or just killing. And so you had Blacks who had gained power through Reconstruction. And there was, of course, a desire to take away that power that had been gained. And so we specifically talk about, not just the sort of statewide political disenfranchisement, but specific acts of disenfranchisement and killing, like the Wilmington massacre, that occurred, where those who had gained power in Wilmington were literally killed or driven out of town. And so we did that not to, make people feel bad or to, remind us of uncomfortable history, but to make it clear that since those systems were formed and political power was established, as it was, frankly, in primarily the hands of white people, primarily white males, that ongoing racism is not even really required in order to live out the racist effects. And so it is why one of the things that we are trying to address, as again, both panelists said, is how can we, forget trying to deal with racism. Let's deal with how are we going to build power back in Black and brown communities where it has been taken away, and put people at the table as important institutional and systemic decisions are being made. So that by virtue of having more equal power sharing, then we're able to come to practices and policies that are not as racist or don't, have the effects of racism. So what does that look like in rural North Carolina? Let's talk about the West, where actually, a lot of times we think of Appalachia as largely white poverty, but that's of course not the case. There are plenty of Black and brown communities in rural areas as well. But you may have a situation in one of our Western communities where we were working deeply in place, where we're funders. We fund 501c3s. We do about 20 million in funding a year, which makes us a medium funder in North Carolina. But there was no one to fund. There were no nonprofit organizations other, than churches. So we started meeting in a church with community members and just started listening to what their needs and concerns were. And one of the things that is required with philanthropies is to truly listen. And start by listening. And that's one of the values that we hold. And so where that took us was into places that were far from what we usually fund when you think of, sort of a statewide health foundation. People said, yes, we're concerned about the obesity rates. That's all over our community assessments and all that. But we don't want to talk about that until you deal with third shift daycare and transportation. And I'm not talking just transportation to the doctor. I mean, I want to go to Walmart. And so we then got into those spaces because we were meeting community where they were, and we started doing funding in those areas. And over time, we helped to build capacity for the first, and frankly, still the only Black-led nonprofit in that particular community where we were working. But so much of the work in that community is now impacted by that group, which has grown tremendously, such that they have worked on local housing ordinances and local policies and practices, local food systems work, but are also able to engage in some of the statewide policy change work that is also needed. And so again, one of the second things that we needed to do then in philanthropy is get specific about the equity outcomes that we were trying to accomplish. So on one hand, of course, is starting by listening to community, but on another hand is don't guess what I'm thinking. Know what we're literally getting at when we say we want to work on an equity outcome, because, as the panelists have said, when you start trying to boil the ocean, or just, get too scattered in what it is you're trying to accomplish from an equity, there's so much that racism has impacted, that if you can't stay focused and fund for the long term, you're never going to make any actual progress. So I'll end on a second example of statewide systems change, was Medicaid expansion. So no accident that most of the states that chose not to expand Medicaid were states where large numbers of Black and brown people, or large proportions of Black and brown people, would stand to benefit from Medicaid expansion. So we were one of the states in the South, largely, who had refused to expand Medicaid since the ACA was enacted. And so the trust has been at this game for a long time. And I hear you, Natasha, people are tired of talking about tobacco, but we couldn't get tired of talking about Medicaid expansion because it's so important if we're going to actually achieve health equity. Everyone has to be under the tent and have health insurance. And so we worked at it and kept funding organizations that were working in that space, advocating for and educating for the need for expansion. And lo and behold, here with this last budget and last legislative cycle, Medicaid was just expanded in the state of North Carolina. And so that tenacity has to be there. And if we're going to talk about addressing racism, we really have to talk about slow burning fuses and people who are in this for the long haul, who are not going to get distracted with every, issue du jour that strikes people's fancy. And so philanthropy, I think, is in the best position to do that because many of us are set up as perpetual funders. And we could continue to fund over very long periods of time the kind of just dedicated work that's needed to really reverse the effects of racism that frankly have been put in place over hundreds of years. And I'll pause there. Maybe there are other questions or comments in the chat.
Sorry, I just had to chuckle at that because you all just gave such full responses and touched on so many things. I really appreciate each one of you all's responses. What I was originally supposed to ask was about the history of philanthropy, but I'm going to flip that because you all have talked about sort of changes over time and how our approaches not only need to be sustainable and need to be long-term and potentially slow moving, but just thinking about how, and someone in the Minty poll talks about like how philanthropy can be viewed as neo-colonialist and how that has been and could still be for some philanthropies, how their work can be framed. But what I want to ask now is, what is your sort of health equity vision? And how has that changed over time? I think that can be sort of viewed like through an institutional lens, which might apply for Dr. Gerald and Natasha and the Center for Black Health and Equity. But I think also just thinking about it more broadly for Dr. Francis. So I think just asking how that health equity vision might have changed over time.
I'll continue the story that I was telling because one of the things that has changed for us, I have been the president of the trust now for a little over 7 years. I think I'm the 4th president in our 75-year history. So we've had very long-standing leadership of the trust, and I've been able to really build upon the work of predecessors. But one of the things that I felt was necessary when I got to the trust was simply to be specific about health equity as a value and as a framework and a lens through which we are doing our work, and to literally write that down and to be clear and transparent about what it is that we're trying to accomplish. So often we'll put out a funding opportunity and it might be in a particular focus area. Let's say it's in maternal health or in access to care. And we'll ask for proposals for people to just sort of, guess what we're thinking or what it is we're trying to accomplish. And they'll tell us what they have in mind. And we'll be like, yes, no, that's it. That's not it. Instead of all of that guesswork, what we're saying is, look, we're trying to accomplish statewide systems change in this area. And this is specifically what we're trying to accomplish. We're trying to build up capacity in these 10 communities among organizations and systems that are interested in having a more equitable maternal health ecosystem, to your point. And so instead of making people guess about what it is that we're trying to do, we'll say, look, if you're interested in this work, Black-led, white-led, whatever, if these are the outcomes that you're trying to accomplish, improved maternal death rates for Black women, then we want to talk to you. And so often what we're talking about are community-based groups or health systems or advocacy organizations that, again, have been at this work for some time. And so what they're needing from us and what we're providing is general operating support. Again, it's not programmatic based. We're not saying, talk to 20 mamas and tell us what you've said to those mamas about how to raise their babies, because that's not the problem in the first place. But instead, let's get 20 mothers together, have them meet with the physicians in the hospital and help break down some of these, frankly, racist practices that are allowing our Black mothers to die at 3 times the rate in North Carolina of white women. So we're putting the system heads with the community on the same playing field together on teams and networks to try to address issues, again, often at the institutional level or the statewide level. And we're being transparent about that. And as it relates to evaluation, I hear you all. A lot of times our evaluative practices can be discriminatory and frankly unproductive, because we're evaluating oftentimes the wrong thing. Did that specific thing that you do contribute to X? To be honest, I don't care about that. I just want to know, did X occur? Because frankly, you can engage in a program or practice that results in change while disparities are actually widening. So at the end of the day, I want to know, did the equity outcome occur? And in terms of attribution of cause, there are likely a lot of things that contributed to that. So frankly, one of the things we've had to do as a foundation is get less wedded to cause and at attribution for change, and more wedded to the actual equity outcome occurring. And who gets to take credit for that? We don't care.
Well, I suppose I'll just add to that. And I think when it comes to how things are changing, like I said, I do think there's a more of an interest in discussing the, getting things or working to address things more upstream. And so I think that's promising. I do think what will continue to evolve, I hope will evolve. You asked like, oh, what would your dream situation be? I'm one of those people that to me, I'm a lawyer, I work on policy. So I'm looking at like the evidence that's what's available, the science, the literature, the lived experience, qualitative data, all of that. I'm look at that. And then I'm thinking, well, how can I make this work for the intended outcome and what works for, for everyone? And so to me, I, think it would be great if the process of being funded by a philanthropy or another organization or government was just, I suppose, receive kind of an overhaul in the way in which it works, to be honest. Like some organizations are doing such a great job. Like, Dr. Gerald is talking about all of the great work that you're doing in North Carolina. It's just, that's wonderful. That's exactly what, we need more funders who are interested in just sitting in the problem and working through the solutions presented by the community most impacted by the issue that you're working on. But I think in general, especially when it comes even to, I know this is not necessarily about that, but like government funding, I mean, the hoops that you have to jump through, and at the end of the day, a lot of the organizations that are funded to do this work, and I'm just speaking for like Black, community-based organizations that are also Black-led, these folks who are leading these organizations, we're talking about sustainability, exactly what you were saying, Dr. Gerald. These are the people who are sticking around. Like you might work at a national health organization, and then you might get another job in 2 years and you're on to the next thing. These people are actually living, in their community. It's them, their family, their community that's all being impacted. That's the sustainability. Invest in them. And that's what we do at the Center for Black Health and Equity. Every time we get funding, we're a national organization, but our main goal is to get it down to the community, like so they can hire people, so they can have facilities, so they can create internships for program specific activities, you know, like hiring young people to do public health engagement. Like there's a lot of stuff that they need and can do to really, not only as you're working to address that specific issue, but like actually contribute to advancing equity and health equity. So I think that's very important for that community level. And then also when it comes to the funding piece, you know, the people, like, we are doing work that we're impacted by. So, you know, we, you know, at our organization, we talk a lot about how the very issues that we're working on impact ourselves or our families. And so that type of consideration, I think, is important too, to say, okay, you know what, you might need a little bit more FTE for this than, you know, we think it takes, because this should be done in this way. Or to say, like, you know, to consider, like, you know, Dr. Francis, you mentioned technology. Like, do they have technological infrastructure that is going to support them in the long run? Like, invest in their ability to get systems or security or whatever, because those are the things in the future as well, and it's going to set them up. So to me, it's like allowing more of funding to go for infrastructure of the grantee and of the subcontractors or the sub-grantees that they may have. So that, to me, I think, is something I'm starting to see more recognition of, but I think that's the most work we have to do, because I do think in general, a lot of discussion about health impact funding and work and philanthropy is already recognizing we need to get into deeper rooted issues systemically when it comes to health. Now we need to do the same thing for the process and the way in which we go about doing it, because that's just as important. And it will automatically, I think, lead to the results and the data being actually what we want it to be, which is what communities have always been saying this whole time. I'm not saying anything new. So that's what I think I'm seeing more. And I also think it's where we need the most work.
Thank you, Dr. Francis. We're running low on time, but would you want to respond relatively quickly?
Yes, really quickly. The only, I'd say yes, yes, yes to all that has been said. The only thing that I would add is I want to see, when I think about vision, two things. So shifting from this notion of constant correction to intentional creation. So what do we want to see? What do equitable and positive health outcomes look like? And how do we invest in the production of what we want to see, while also addressing the challenges, realistic challenges that are on the table. So kind of a shift in that. And I think we're starting to see that. And that calls for the second piece, an evolution of our practices and our approaches. So if you look at kind of the arc of the history of philanthropy, and that was one of the questions on the table, it has changed over time. The those who are giving, those who are in power, the approaches, all of the systems and structure behind this practice has changed. I think we're at another point in history where we're seeing an opportunity to evolve. So the things that we're calling for that have been mentioned on this call, I believe, are part of that evolution. So revisiting what our entry points, what our application processes are, so that all of those hoops that we have to jump through don't necessarily exist. During COVID, we saw kind of basically a stripping down of application processes for people to basically submit your budget and maybe like your name and what the project is, like on 2 pages. That's unheard of. But that proves that we can do it. So really changing how the process and how this work is done, so that the resources can get to the people who are doing the work on the ground to heal our communities in a sustainable and lasting way, so that we can have thriving existences rather than constantly being focused on fixing what's broken. So that's my bold, big vision. May not happen in my lifetime, but I want to see it.
Thank you. I'm really glad I asked, because that was deep, and I really appreciate how you framed that. I really want to thank all of you all for your insights, your wisdom, your thoughts. I think, just like someone said in the chat, that we might need a part 2, because there's so much to think about and discuss. So I really want to thank you all. Thank you so much. Thanks. All right, so as we close this webinar, we'd like to learn from you about how practical and applicable to your work the conversations we've had today are. So we'd like you to fill out this short survey that you should be able to access through a link in the chat or by scanning the QR code that you are seeing on the screen. With that, we want to invite you to join us for some upcoming activities. Sorry, I'm going to leave the QR code on the screen, but the link is in the chat as well. For our next activities on Wednesday, October 25th at 12 p.m. Central Standard Time, we will continue our newest workshop sprint on community systems dynamics. Registration is still open for that, so you can join us. Also, save the date for Tuesday, November 21st. We will have our next webinar on upending power inequities. So for more information about our upcoming activities, it's available on our website, partnersforhealthequity.org. You can follow us on social media and help us spread the word by sharing our content that most interests you and your work. See you soon and take care.